Serious, doctors of Reddit, what is the rarest disease that you've encountered in your career? MQD Saber. It's a rare form of scleroderma that makes your skin looks like you've been cut by a knife down the center of your face. This poor lady's mandible actually split in half. The rarest I've encountered is kid syndrome, keratitis ichthyosis deafness. A 5-year-old, very sweet, blind girl who literally had rough, thick, opaque skin on the surface of her eyes. Gorham's disease aka vanishing skull syndrome. A softball size area of my patient's skull disappeared and left behind a soft spot. She ended up with a plastic plate to protect her brain. Crazy disease. Edit. I changed brains to brain. I used the plural in jest as brains can be used when referring to dissected brain tissue. Pseudocyesis or hysterical pregnancy. In a woman who was an inmate in the psych wing of a prison I rotated through. She thought she was pregnant with Jesus's triplets and had grown a massive pregnant looking belly. Was producing milk, etc. Harlequin ichthyosis. In med school there was a baby born with this. Basically their skin scales up and peels, removing that very important barrier, so kids born with this don't live long. She was just a couple months old and had not yet left the hospital since birth. Fibrid dysplasia ossificans progressiva, FOP. A disease that calcifies soft tissue and turns it into bone. When I was a medical student our group's cadaver had this disease. During dissections we sometimes would get poked by spiky pieces of bone in random areas of her body. Also had a spine that resembled a small turtle shell. I scrolled the thread looking for this as my sister has FOP. She's now 36 and a lot more is known about the disease than when she was a child. Lack of information in her youth led to several misdiagnoses and attempts to treat or operate actually cause flare-ups which can quicken spread. We had a patient once, a young girl, who was so sick that it broke our data analysis pipeline. When the code ingested a genome sequencing sample, it attempted to detect the chromosomal sex of the patient. It was using two metrics. The sample was considered female if it, 1, lacked Y chromosome, and 2, was heterozygous on X chromosome, implying there were 2 copies of it. Otherwise the sample was considered male. This one sample registered as female on metric 1, no Y chromosome, but male on metric 2, very little heterozygosity on X chromosome, which was not anticipated and resulted in our pipeline crashing. Upon investigation, it turned out that the parents of that poor girl were brother and sister to each other. As a result, she had very little genetic variation throughout her genome, not just X chromosome, and was consequently very sick, with a plethora of diseases typical for consanguineous births. Maybe not the rarest, but saw a 4-5-year-old patient with Lesch-Nyhan syndrome on my PEDS rotation in med school. It's an X-linked recessive disease that a quick Google search tells me affects about 1 in every 400,000 individuals. It's due to a mutation in an enzyme involved with DNA recycling. The thing all med students remember about it is for whatever reason these patients have a tendency to self-mutilate. My specific patient had to have a procedure to have all his teeth removed because he would terribly bite his arms unless he was physically restrained. I believe he had an older brother that went through the same ordeal. So sad, but definitely one of the more memorable cases from med school. Walking corpse syndrome, cotard delusion. 17 years in mental health and I've seen it once. The belief that some or all of you is dead. The guy was so certain he was dead he believed he was a zombie. Eye doctor here. Patient had bilateral acanthamokeratitis. Estimated that 0.0004% of contact lens wearers will be diagnosed with this condition in one eye. My patient had it in both. Acanthamokeratitis is a rare parasitic infection of your cornea. I didn't think this would get that much attention. My patient presented after coming back from vacation complaining of a little hazy vision and his eyes feeling a bit off. His cornea looked pristine but I did note a little ocular inflammation. Turns out he had an underlying autoimmune condition, ankylosing spondylitis, known to cause ocular inflammation, uveitis, and recently stopped taking his medication, so I thought this was a slam dunk case. When he came back for his follow-up, we realized this was not a slam dunk. And we sent him out to a corneal specialist ASAP, and now he is back to 20/20 vision in each eye. His case ended up being caused by wearing his contact lenses while swimming in a lake. Remember, don't sleep, shower, or swim with your contact lenses on, and make sure to visit your eye doctor for regular checkups. Malignant hypothermia in my 11-year-old patient. I was only in my second year of anesthesiology residency and I thought she was going to die. I had a salty old anesthesiologist as my attending and she calmly led the whole team through the treatment. My patient did great and her labs were all normal when I took her to the peds ICU. I couldn't sleep for 2 nights and still haven't gotten over it. On my OB rotation during ER residency, I helped deliver a baby who had spots all over. Further blood testing revealed the baby had developed leukemia while in the mother. Didn't know that was really possible prior to that day. Incredibly rare. My colleagues had a patient with catecholamine-induced ventricular tachycardia. AKA every time this 13-year-old exercised vigorously or even got too scared, the adrenaline would induce a deadly arrhythmia that needs to be shocked before long in order for him to survive. Seriously. Dermatologist here. Some fun ones. Chromhidrosis, where sweat comes out in different colors. My patient's was blue. Argyria, a permanent discoloration from silver overdose. Aquagenic urticaria, an allergy to contact with water. When I was in nursing school I took care of a woman with fibrodysplasia ossificans progressiva. Basically your muscles slowly calcify to bone. And every injury, even small ones, speed up the process. She was pretty much wheelchair bound and needed 24 hours care. Edit. Thanks for the votes everyone. The saddest case I had in nursing school was a woman with end-stage ALS. She was just there. She was hooked up to a ventilator to breathe and her eyes were fixed open. She couldn't even blink or move her eyes. The other nurses at the facility told us this story. She had a fairy tale marriage. Her husband had money and was going to help find a cure. While she was still mobile he bought her a farm filled with all the animals you could buy. Even a pet peacock. By the time I worked with her the facility was waiting for her to die because nothing could be done. Her husband would come in every morning, sit by her bed, and cry. Actual scurvy. Poor old man didn't know how to cook after his wife died and ate nothing but biscuits. Neurologist here. We see a lot of weird stuff. Autoimmune encephalitis, brain on fire, late onset familial neuromuscular diseases, rare presentations of cancer, or paraneoplastic disorders. But one rare one sticks out for me. We had a patient who had come in with confusion and aphasia, trouble speaking and understanding. We got more of a workup and saw small strokes all over, but in peculiar distributions, and not ones that would explain his findings. Along with it we saw microbleeds all over superficial parts of his brain. Turns out he has what's called cerebral amyloid angiopathy related inflammation. It's an extremely rare inflammatory subtype of a stroke disorder that we still aren't totally sure what it is. It has similar amyloid deposition you see in Alzheimer's, deposited around vessels, which makes them weak and prone to stroke and bleeding. It causes rapidly progressive dementia. I presented the case to our department, a large academic center, and most had never heard or seen it in their career. A couple of the stroke doctors were the only ones who knew about it and they'd never seen it. Really interesting case. Patient admitted for something unrelated, starts deteriorating for no discernible reason. Has some mild generalized abdominal pain. But other than that no specific symptoms. However, he keeps worsening to the point where he's barely hemodynamically stable. On the abdominal contrast CT, there's fluid everywhere. Organs pushed against the abdominal wall. Just one enormous grey puddle from the top of his pelvis to his diaphragm. And then, at some point, There's a scribble of white pretty much smack dab in the middle of it all, in this context, signifying active bleeding. It was shaped like the world's smallest firework pop. And it was nowhere close any major vessel. Everyone was dumbfounded for a hot minute. It turned out to be a spontaneous, atraumatic rupture of the cystic artery. No surgeon in the building had ever seen one. Persistent genital arousal disorder. Having multiple orgasms a day, at any time, without any stimulation, becomes quite bothersome and uncomfortable. Limits your daily activities and sleep is interrupted. Over time, patients can become very hopeless. It is remarkable the dissonance between the name and the obvious joke, and the tremendous suffering these patients endure. Rarest disease that I've seen in my career thus far would have to be leprosy. It's something that one hears about in antiquity and something I read about in books, but I never expected to actually encounter it in my career. Anti-NMDA receptor encephalitis. 1 in 1. 5 million. Psychotic symptoms, auditory or visual hallucinations. Paranoia. Delusions, due to an autoimmune disorder where your body produces antibodies against NMDA receptors in your brain. We've seen 2 this past year at our hospital. The real incidence of this could be higher than 1 in 1. 5 meters, but might not be tested for often enough. Once someone gets labeled a psych patient, consideration of medical etiologies often goes out the window. Goodpasture's syndrome. Incidence rate of 1 in a million. Autoimmune condition that affects the lungs and kidneys. Med student here. This happened in my first year of med school. When I was learning physical exam maneuvers, we learned to examine from the patient's right. But in this case, the senior medical student in the room with me was at the patient's right. I started auscultating the standard APTM spots for the heart, but I performed them from the left side. When I had concluded the exam, I said I heard normal heart sounds. The senior student told me that I had auscultated in the spots opposite of where I should have. He then performed them properly and looked puzzled when the heart sounds seemed displaced. It turned out the patient had extracardia. Alpha-gal tick-borne disease that makes you allergic to red meat. Lone Star ticks transmit this, which always seemed ironic to me that a Texas-themed parasite would stop you from eating red meat. I had a gentleman who came into the emergency room with extreme fatigue and was found to have very little blood in his body. I asked him what his medical conditions were, and he told me he had polycythemia vera, which is a condition where the body makes too much blood. The opposite. He told me he had been diagnosed years ago but had never needed treatment. At first I thought he was mistaken about his diagnosis. And then I was worried that his bone marrow might have gone into overdrive and eventually burned out. Eventually, we discovered that he did have polycythemia vera, but had been slowly bleeding from an obscure GI bleed. A tiny blood vessel in his small intestine that would come in and out and bleed small amounts into his stool. In essence, his body was self-treating, having too much blood by doing its own bloodletting. For years. 1 week he bled a bit too much and got out of whack and ended up in the hospital, which is where I met him. Crazy case. Psychiatrist here. Anti-NMDA encephalitis. As seen on the movie Brain on Fire. About 2 cases per million per year. I've actually seen 2 cases 12 months apart. Oh snap, I just had a patient with that. His symptoms were absolutely wild. Then he recovered a bit and threw his headboard at me. I'm glad it's rare. OBGYN here. I'm probably conjoined twins, thoracoephagus, and a couple of cases of complete androgen insensitivity syndrome. Rarity varies a lot by discipline. I'm in general surgery, so I see things like Fernies and neck fasc pretty regularly, but have never treated an ear infection in my whole career. That said, strangest presentation for me so far was a gentleman who had had an anti-reflux procedure on his stomach and esophagus, Nissen funduplication with a hiatal hernia repair. Then had a recurrence and got a redo, which required a procedure to lengthen part of his stomach, cholecystoplasty. After that procedure, you have a staple line in your stomach. His hiatal hernia recurred again, bringing his stomach back into his chest, and he formed a connection between his stomach and the sac surrounding his heart. He presented to the emergency department dying because the gas and stomach contents could get into his pericardium, but not out, and his heart couldn't expand adequately to pump. Mad props to the ED doc who figured it out and saved his life before shipping him to me. Methemoglobinemia. Proteus syndrome. Child syndrome. Also once sewed up a wound from woolly mammoth bite. Palia grad student tripped and fell into a bone reconstruction table. Needed stitches. OB nurse. We had a patient back when I first started who had 2 separate uteruses and cervixes, and somehow, with the help of IVF, managed to get pregnant with 1 baby in each. The other case was a patient who was delivering her 4th set of twins. She had had 4 pregnancies and was pregnant with twins each time, no IVF with this one. Her oldest set were 4 years old. As a former dentist, the weirdest thing I saw was a mustard seed that germinated in the cavity of a fellow's molar. Nursing student butt. Scurvy. We don't see it very often because of the widespread of vitamin C in most foods. Patient had OCD plus agoraphobia, making their diet extremely limited. And never left house, so mostly noodles and instant ramen 1 meal a day. Was eventually found almost dead with no teeth by a wellness check when neighbor thought he was dead after not hearing him moving around flat in over a week. 30-year-old African American in active labor with about 5 family members around her. I am the pediatrician at bedside waiting for the baby to come out so I can examine him. He comes out and all of his poor little distal limbs are severely disfigured or missing digits. Turns out he had intrauterine amniotic banding. Pieces of the amniotic sac get wrapped around limbs and digits. This causes strangulation of the blood flow and prevents development. Worst thing I have ever seen and 1 in 1 million chance of happening. But mom took him in her arms and loved him all night long as if nothing was different about him. Not that rare but very creepy was side neglect after a stroke. The person completely forgets that there is more than one side to their body. They will brush only half their hair, do makeup or shave half their face and use only one hand. If you put an object into the hand on the neglected side, it is as if it disappears for them. And it's not paralysis or they are able to move that arm. It's just to them. That half of the body does not exist. Strokes are fascinating actually. Or rather, our brain isocele can be fully paralyzed from a tiny stroke in an important brain area. Or you can have a huge stroke in a non-important area and be totally fine. Veterinarian here. I've diagnosed a cat with Ehlers-Danlos syndrome. This is a disease of essentially abnormal collagen, so the skin is extremely stretchy but also very fragile. Almost any handling of this cat or clipping of fur for whatever reason cause massive skin tears. Diagnosed this girl 25 years ago or so, when we used to scruff for restraint. You can imagine the trauma my assistants caused before we realized what was going on. Complex regional pain syndrome. Essentially in this case they got a sprain. And it resolved. Unfortunately the brain has decided that the affected area needs defending and sends severe pain signals 24/7. Terrible disease that's incredibly difficult to treat. Also has a tendency to spread. Clinical lab scientist here. Doing the testing. I once saw mold growing from a brain tissue. Patient was immunocompromised. He eventually died, but not before pretty much every piece of tissue submitted for culture grew fungus. The type of mold growing was common environmental flora. Alternaria species. Probably not the rarest I've ever seen. But Fernie's gangrene comes pretty close. Only saw it once in my career. Don't look it up if you value your stomach contents. Pathology here. We had a patient come in ultimately diagnosed with metastatic lobular breast carcinoma. Showed up in a bone marrow for an anemia workup. Patient was male. I saw a patient after being treated for actinomycosis, which is a rare bacterial disease that causes the formation abscesses everywhere in the body. He had some rare multi-resistant variant of actinomycosis. This lady was only in her 30s and had multiple surgeries to remove damaged organs, hysterectomy, oophorectomies etc. I was seeing her after she was successfully treated for something along the lines of survivor's guilt, as they had antibiotics shipped from the US to treat her, because she had a better chance of survival than one of the patients in the US. So they gave my patient the antibiotics. Whoa. There's some wild cases here. Makes me appreciate doctors. And the fact that I have gotten lucky and haven't had any crazy diseases or disorders. While not super rare, my young daughter was diagnosed with pediatric Graves' disease and was on the verge of having a heart attack. She was 10 at the time I took her to the clinic. The DR asked us if we could allow the pediatric residents to come in and view all her symptoms: eye disease, massive thyroid and very high BP. I tried to make jokes about scaring the residents when they came in, but I was pretty terrified. I had acute fatty liver of pregnancy. When I was 36 weeks pregnant, my baby stopped moving and they did a C-section. My liver failed and I was in ICU for 3 days. They were getting ready to do a transplant, but I didn't need it. My poop was beige and my pee was brown. I had retained a bunch of fluid. And I had bruising up my legs and back. My son's APGAR score was 1. He was in the NICU for a couple of days. I am mostly okay. I have some trouble with getting tired easily and getting up and down off the floor. Nurse here. Cared for a patient who was the victim of Munchausen's by proxy. My searchy mom knew a nurse who cared for a child who they later learned was only sick because of his mom. I'm an RN and married into a family where Peutz-Jeghers syndrome is common. Basically, you get polyps throughout your entire GI tract. Increased risk of cancer all over. And it is super easy to diagnose because you get dark discolorations on your lips that look like freckles. My father-in-law had it. My wife has it. And both our kids have it. Colonoscopies are way too normal around here. My wife was diagnosed with breast cancer at 30, so we were super paranoid about our daughter getting it too. He came out as transgender, and when he said he wanted to have top surgery, my wife and I were super relieved. Bulbous pemphigus vulgaris in a 38-year-old woman. Careful doing an image search for this. Very rare for her age. And steroids were not working well. She developed a severe bacterial infection that only responded to linezolid, a very expensive third-line antibiotic. Using up our hospital's supply for the month in less than a week. Extremely painful and debilitating disease during a flare-up. Her skin sloughed off at the slightest friction. And it extended to her mucous membranes, including mouth, vagina, and anus. Fabry's disease, lysosomal storage disorder. Patient had a family history and got tested. He was asymptomatic and just got lucky enough to talk to his family that had a positive result. Most memorable: prostatic tuberculosis. I'm the patient. But I was born without a thyroid gland at all, or it's 100% defunct. I'm on total replacement. Without exception. Every doctor I meet puts their hands around my throat alarmingly quickly. They also double take when I tell them my current hormone prescription. Lots of people take thyroid hormone replacements as they get older. 2 of my grandparents included. But they take around 50 micrograms. I take 175. Exercise celery-induced anaphylaxis. In other words, they could exercise and they could also eat celery. But if they did both close together, they would have an anaphylactic reaction. Probably not that rare. But I remember having a patient with it years ago when I was a nursing student and no one on the ward had ever seen it. I haven't seen it again. Tumid lupus. Autoimmune condition. Breakout in fevers. Rash and blistering itchy sores with internal bone and muscle pain due to the body reacting to UV light. Egg fluorescent lights. The sun. Hutchinson-Gilford progeria syndrome. Takotsubo syndrome, as a woman was at her husband's funeral. Stiff person syndrome. I only diagnosed the Takotsubo, but was on the team in the early treatment of the other 2. Stiff person was idiopathic as far as we could tell. During an acute attack it was a real bugger to treat. There's very little literature or guidance. Pathologist here. Rare diseases for most other doctors are commonplace in our field. I've diagnosed multiple leprosy cases and rare cancers that have only a few published cases in the literature. Some are so rare there aren't names. And we just describe the cancer. Intellectually challenging for us. Terrible for oncologists who might not know how to treat that entity. The people at the walk-in clinic were shocked to encounter my dad. It's a genetic thing that lasts 3 years and then disappears. Basically your body just makes new skin for you non-stop. It's easier to get cuts and you are bright red and itchy.